This video will review the integrated competencies for dietetic education and practice and their applications in the practicum setting. ICDEP version 3 was finalized in 2020 after completing a 3-year stakeholder consultation process that involved input from practicing dietitians, dietetic educators, and dietitians working in Indigenous communities across the country. Competency-based training ensures that learning outcomes and dietitian practice abilities are clearly communicated across students, teachers, and preceptors, employers, governments, and the public. That there is consistent education and training across the country. This ensures that dietitians can work in any province and enables international recognition of our credentials. Education and training are aligned with current practice. This maintains our standing with our fellow health professionals, maintains our standing international, and maintains our standing with our clients, patients and families, and communities that we serve in our practice. ICDEP identifies 7 domains of practice: food and nutrition expertise. Dietitians integrate their food and nutrition expertise to support the health of individuals, communities, and populations. Professionalism and ethics. Dietitians use professional, ethical, and client-centered approaches to practice with integrity and accountability. Communication and collaboration. Dietitians communicate effectively and collaborate with others to achieve practice goals. Management and leadership. Dietitians use management skills and provide leadership to advance health through food and nutrition. Nutrition care. Dietitians use the nutrition care process to provide individualized care. Population health promotion. Dietitians assess food and nutrition needs with communities, populations, and collaborate in planning to promote health. Food provision. Dietitians manage and consult on quantity food provision to support health. Professionalism and ethics, communication and collaboration, management and leadership are foundational and underpin dietetic practice across all practice areas. Each domain is divided into practice competencies, which are further described in the performance indicators. Practice competencies describe the minimum set of practice abilities that dietitians are expected to possess at the point of initial registration, while each practice competency is written as a distinct statement of ability in practice situations. Competencies are not applied independently. In reality, each competency informs and qualifies the other, and the dietitian applies them in combination according to the situation at hand and using their professional judgment. Practice competencies are demonstrated by the dietitians in their everyday work. For example, conducting a nutrition counseling session involves the application of several nutrition care competencies, as well as competencies in professionalism and ethics, and in communication and collaboration, and management and leadership, among others. The purpose of the performance indicators is to express the learning outcomes expectations for pre-registration education and are applicable to students in the Brescia MSCFN and DDEP programs. They are an outcome-based ability that is observable to others. Performance indicators are considered as competencies to be demonstrated before you become a dietitian. They are assessed in your undergraduate program and during the practicum and in the CDRE. To think about this, consider practice competency 3.01, use appropriate communication approaches. There are several performance indicators. Identify opportunities for and barriers to communication relevant to the context, and use communication approaches appropriate to the context. Provincial dietetic colleges across Canada have stipulated that to be eligible for registration, all candidates must provide evidence that they have met the integrated competencies for dietetic education and practice, have a minimum of 1,250 hours of training in dietetic practice, and have met the program requirements. They must successfully complete the Canadian Dietetic Registration Examination. In order to meet the program and registration requirements, students need to demonstrate competence across all performance indicators. That is to say, they need a C rating on every item. Each placement context is different, so having competent ratings across multiple placements is important to demonstrate your overall readiness for dietetics practice. A key point to remember is that competence is an observed behavior. What that means is that as a student, you need to show your preceptor that you are competent through your words and actions. You need to actively participate in and contribute to the practice activities of the preceptor. What this means as a preceptor is that the student needs hands-on practice activities and that you directly observe a student's performance in order to assess their competence.